Thanks, Chairman, and good morning, everybody. So it's my great privilege to be here to present our study from Shanghai Regional Hospital. I have no conflicts of interest to declare. So in our study, 233 patients were included with 707 vein grafts. So the patients were all evaluated with coronary angio CT at around 1 week after the operation with Fitzgibbon grade. So in this study, the Fitzgibbon grade B and O grafts were defined as VGF, and the multinomial logistic regression analysis was carried out to detect the predictors. So our results show that the early patency of SVG at 8 days was around 94%, and the increased preoperative platelet count, the perioperative transfusion, and the clearance of creatinine were the predictors of VGF at patient level, whereas the use of Lima graft could protect the patients from VGF. Then at graft level, so it's the same, the increased platelet level and endarterectomy and the perioperative transfusion and the clearance of creatinine was predictors of VGF, whereas the greater runoff, the depth therapy, the side-to-side anastomosis, and the greater diameter of the recipient vessel was protective factors. So our conclusion is the early patency of SVG after OP-CAB was satisfactory, and the depth therapy was effective for OP-CAB patients, and the aggressive medications such as depth should be considered for patients with elevated preoperative platelet, transfusion, lower graft runoff, and endarterectomy. Thank you.
Thank you very much, Dr. Yang. Very nice study. Congratulations. I know your group published a paper about dual antiplatelet therapy in JAMA. So that's a very nice work. But I want to ask why the use of Lima is a predictor of the vein graft failure.
Yes, I think that because in this study we have around 15% with the cabbage, the OP-CAB did by total vein graft. So these patients will count, because in this study, if a patient with one VGF, it will be an event for patient VGF. So some patients did by the total vein graft will count for the statistic with that. I think it's a reason.
And did you analyze, for example, the distal runoff through the pre-op angiogram and predict whether that's correlate the incidence of a vein graft failure?
Yes, we calculated. Actually, we did a cutoff. So for the diameter of the target vessel, if we select the target vessel more than 1.5 millimeter, actually it is calculated with the shunt used in the operation. It will get a better result as compared to some small vessels. And for the runoff, we also did the analysis, but the problem of our study is that in our center we did the sequential the bypass surgery, so it's difficult to calculate the runoff of each anastomosis. So in this study, for the sequential grafts, we divide the runoff by the grafts, number of the grafts. So we didn't get the cutoff of the runoff.
And any of the vein grafts used in this study was harvested through the endoscopic way or open?
No, it's all open way.
Open.
Yeah.
Okay. Yeah, please. A question.
Thanks very much. Some of your factors like the use of a lemur or a transfusion as a predictor of vein graft failure is obviously not logical. I mean, that must be just an association, not a causation. So, but the question I want to ask is, your mammary patency was 100%, your radial patency was 100%.
Yeah.
What would you like to speculate if you stop using the vein and only use those two?
Yes, it's a good question. So, yesterday we have, I think, a session of coronary bypass surgery, and I think so. The radial artery is very useful. I agree with you, and also I read the publication of Professor Godino. So, but I think the vein, it is still a graft we cannot ignore. So maybe maybe if we did some treatment for the vein, we can improve the patency. I think also I read the publication of Professor Goldman, and I think probably it's not the problem of the vein, but it's a problem of the target vessel, because as we can see, if we see the 10-year patency of the vein, if we anastomosis to the LAD, it could reach to 90% around. I think it is 88 or 89, something like that. So we have the space to improve for the vein. It's my opinion. Thank you.
Any other questions, please? Yes.
Did you look at the angiographic characteristics of the vein graft you put on? For instance, the diameter of the vein graft. The diameter of the vein graft, does it matter for the patency?
Yes.
The relationship of the diameter of the vein and the target vessel, for instance.
Yes, we did the analysis of the diameter of the vein, but no significant results was found.
But there is a Japanese paper actually indicate the discrepancy in the diameter actually correlates with the vein graft failure rate.
Yeah.
Anyway, thank you very much.
Thank you.
Excellent study.